This week we will discuss the use of and challenges of using informatics technology in genetics and genomics in clinical practice. Your readings are from various websites related to this topic. While genomic testing technology is relatively inexpensive and produces large amounts of data in a short period of time, there are challenges to ensure that the data is used appropriately and maintains privacy and confidentiality of the individual being tested. Bioinformatics has evolved as the study of individual genes has expanded to the study of all the genes in human genome and how these genes interact with the environment and how cultural and psychosocial factors influence our genes. The application of genetics in clinical care of patients is becoming more readily available, and the scientific advances of genetics is reforming our perceptions of health and illness. For nurses and other healthcare professionals who play a critical role in genetic medicine, it is crucial to understand the definitions and the implications of bioinformatics. There are several types of genetic testing and diagnostic technologies. Current clinical applications of genetic information include the areas of sociology, where mutations of genes can help inform providers on the effective treatment regimens. In obstetrics, genetic testing for advanced maternal age patients helps identify common chromosome conditions of the fetus. For patients undergoing anesthesia, knowing if the patient has a genetic tendency for malignant hyperthermia can help guide anesthetic choices which prevent complications related to the anesthesia. In pharmacology, genetics helps identify patients who may not metabolize warfarin well and guides dose adjustments for these individuals. There are several types of genetic testing. Diagnostic testing confirms or rules out a diagnosis. This testing is indicated when symptoms already exist. Carrier testing determines whether an individual is a carrier of a recessive or X-related and linked Mendelian disorder. Predictive or presymptomatic testing indicates whether a person is very likely to develop a condition such as Huntington's disease. Prenatal or antenatal testing looks for genetic and chromosomal disorders such as Down syndrome. Susceptibility testing determines an individual's genetic risk for an etiological complex disorder that involves multiple risk factors such as diabetes or heart disease. And finally, pharmacogenic testing analyzes genetic variants to predict an individual's response to a specific medication or class of medications. The process of reporting and storing genetic results provides a vast amount of DNA information, some of which is important and some of which may be irrelevant to clinical application. First, the patient gives permission for the DNA to be collected. Next, the appropriate sequencing testing is conducted and the information is stored in a secure database. The DNA is studied to identify variants, and then these variants are assessed for clinical significance to the patient. Results are then reported to the provider, who then communicates the findings and guides the patient to make decisions that are within their personal beliefs and preferences. Embedded in this process are the HIPAA rules related to patient confidentiality and privacy. How is information stored in the electronic health record? What are the patient's rights to confidentiality and privacy with regard to data mining of large amounts of genetic information? Privacy and confidentiality regarding the right to access health information as defined by HIPAA apply to genetic data. However, some argue that since genetic information can predict the occurrence of disease in the future and has implications for both the patient and their family member, genetic information is different and requires a different level of protection. Additionally, the Genetic Information Non-Discrimination Act protects individuals against genetic discrimination in the workplace and by their health care insurance plans. The law states that employers cannot discriminate by using genetic information to make hiring, firing, promotion, pay, or other decisions. The law also states that health insurance companies can't use genetic information to determine eligibility, premium amounts, or coverage terms. Browse the GINA help site to find out more information on the protections this law provides individuals who have their DNA collected and stored. All nurses need a basic understanding of their role in genetic and genomic testing and how these results impact health and disease. As we learned earlier in this course, the nurse needs the ability to conduct credible website searches for genetic and genomic information. One of the most common tools we can use to help gather genetic information is the family genogram, where patients are asked to report significant disease and death occurrences in 3 generations of their family. As with all procedures, informed consent is an integral part of genetic testing, and the nurses must ensure that the patient understands the process and the implications of the test. Safeguarding the patient's privacy and confidentiality with regards to their genetic information is critical. The American Nurses Association has much more information on the competencies and skills that nurses must have when working with patients and their genetic data. The link to that information is found on this page.